Greetings, I'm Dr. Rhonda Coleman, Doctor of Acupuncture and Oriental Medicine. I received my formal education at Colorado School of Traditional Chinese Medicine in Denver, Colorado, and went on to complete the clinical doctorate at AOMA Graduate School of Integrative Medicine in Austin, Texas. The specialty was in pain and psychosocial events related to pain. So my actual healing work actually started in performing massage therapy. I really enjoyed the holistic side of the treatments and decided that I wanted more information. So I went on to study dietary nutrition, and through that program found a class in complementary and alternative medicine that introduced me to traditional Chinese medicine. What really piqued my interest about the Chinese medicine was the internal medicine diagnosis and the work with the herbs. There was something about it that reminded me of my childhood. My family is from Central America, and in Honduras there are a lot of roots and herbs that are used in everyday cooking, but also for common ailments like colds or aches and pains in the muscles. And so the herbal side and the finding patterns to diagnose root causes of disease really piqued my interest about the Chinese medicine. Most of the people that come in to speak with me or seeking treatment from me come in for pain. When they come in for pain, oftentimes I find that the root cause of the pain has nothing to do with injury or trauma. It's related to some stress. I also do a lot of work in digestive health and weight loss, and that's very interesting because I myself had a lot of issues. I've always been a slender person, but I had many digestive issues growing up that went undiagnosed or that were unrecognized as being related to food sensitivities and food allergies. And I find that when people are having a hard time losing weight or managing their weight, despite eating well, despite having regular exercise routines, it's related to eating foods that their bodies cannot process. So for me, the issue was dairy, which I knew from a very young age. I never even really enjoyed the taste of milk, but also gluten was an issue for me. And I get a lot of people that come in and say, oh, isn't that just a fad? Everybody's talking about gluten. Either they don't know what it is or they don't believe that it's a problem because it's so commercialized right now. Some of the signs that people will miss with sensitivities to gluten or to dairy or to corn are frequent bloating. If you eat and your stomach is extended to the point that it looks like you're 2 to 3 months pregnant, then that's one sign that you're eating something, if not gluten, that your body is not tolerating well. Another sign is tiredness, and in the Black community especially, people think it's a proud moment to have eaten something and then just have the itis. You're just ready to go to sleep. But food should energize you. So if you're eating and then immediately following eating you feel tired, you want to take a nap, you're not focused, then something that you've eaten is not being processed properly in your body. Other signs include breakouts, so adult acne, and rashes. Eczema on the skin is often related to food as well. When I had my son, his first year included a lot of stomach upsets. He was puking a lot more than a baby should. His stomach was always bloated and tight, and he just did not seem happy. He always was just a little bit too quiet, and I knew that it had to do with something that he was eating or something that I was eating as I was nursing him, but it was difficult. At the time I was still living in New Orleans, and New Orleans is known for amazing food, a lot of it containing creams and milks and cheeses and also breads, so gluten. And being in that environment made it very difficult to make any changes to my diet. I was part of that culture that, you know, we've always eaten this way, why would I want to change? If I eat something else, it's not going to taste as good. So I was very reluctant to make the changes that I felt like I needed to make. Then I moved to Colorado, and being away from the temptations of just the smells and the culture around eating in New Orleans made it a lot easier to make some lifestyle changes. And so the first one was to completely rid my diet and my son's diet of milk or any dairy related products. And then later, after he was about a year old, we decided to try gluten. So we removed bread and pastas from our household and just ate rice and vegetables and meats, and there was a huge improvement. From then on, I did a lot more research and study into the impact that food and diet has on overall health. In addition to treating digestion and weight loss, anxiety, stress, I treat all sorts of pain, chronic and acute. I treat common cold and flu, allergies. I treat women interested in fertility, prenatal, postnatal, infants, as well as people in chemotherapy treatments or post-cancer treatments. I'm passionate about helping patients reach a place of balance so that their bodies can begin to heal themselves. If you're ready to work with me, schedule an appointment for a consultation and I'll be happy to work with you.